The NHS is on its knees and it's leading to hundreds of people dying needlessly every week. The message is thousands came to defend Britain's National Health Service. It came ahead of the latest strike in the sector, pushing for better pay and more investment.
Now, this demonstration has been called by various healthcare unions and campaigning bodies, but behind them lies a huge workforce, and they've been warning for some time that the whole system's being underfunded, leaving them demoralised.
Save our NHS!
Jordan Rivera is an occupational therapist at a public hospital. She's been busy supporting colleagues taking strike action, and before this protest, she told Al Jazeera nobody takes the decision lightly.
At the minute, it feels like that's the only way to fight for the NHS, actually. And we're not just people who work in the NHS, we are patients as well. These are our family members who are also impacted if there was no NHS there.
Campaigners accuse the government of pushing people towards private healthcare and allowing the NHS to decline. That warning was taken up by US actor Rob Delaney, whose 2-year-old son died of a brain tumour.
And because of the way that the NHS has started, the flame, the purity of what the NHS is, and how it's free at point of use, and how there is no barrier, no for-profit barrier between you and your care, we didn't spend a minute on the phone with people from health insurance companies saying you can't get that MRI, we don't approve that drug.
Next week, junior doctors, who make up 40% of the medical workforce, stage 3 days of strikes. They say real terms pay cuts and increased workloads are driving people from their profession like others.
Family doctors have one of the highest professional group suicide rates because of the stress that they're under. And then the government attacks them for not working hard enough. Ambulance staff are worried that by the time they get to somebody on an emergency in their home, they'll find a dead body rather than somebody that they can look after and care. There's a massive level of anxiety on the back of COVID, where they gave everything.
With the NHS a top priority for British voters, the politicians are under pressure to commit to saving it now and in the long term. Nadim, Al Jazeera, London.